Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, Doctor of Acupuncture and Oriental Medicine, Chinese medicine herbalist, and founder director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Bianca Rodriguez, a holistic psychotherapist, Dr. Heath McAllister, a naturopathic doctor and registered herbalist, Leona West, a clinical nutritionist and herbalist, also trained and certified in functional medicine, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is, what should I do if I think I have COVID?
Oh man, I am using the well as it was designed. I'm so grateful that I have you guys at my fingertips. I have a stuffy nose and a headache and my throat is itchy. And last week I thought it was allergies, but now it's kind of persistent and I'm fatigued. And I'm like, what do I do? Do I have COVID? Do I have a cold? What's going on? I don't know what to do.
Well, my first look at is what type of respiratory things are happening. And I know when we screen patients here, we take everybody's temperature. We also want to know if they, have a cough or other respiratory issues. Just a stuffy nose, runny nose, post-nasal drip. Could be allergies, could be a common cold, which lots of us get every year, and we're going to that season anyways, especially with the temperatures changing. So, do you have a history of being around or exposure to someone with COVID? Otherwise, if it's just a runny nose and a little post-nasal drip, I think I would just wait it out.
I'm definitely going to wait it out because I definitely don't want to give anybody whatever I have, whether it's COVID or a cold. I am staying put.
That's good. You're socially isolating, which is what we should do to limit the transmission of communicable diseases. Now, I would say that COVID has a myriad of symptoms that can come along with it. And sometimes some are more predominant. Sometimes it's just really extreme fatigue. Other people get gastrointestinal issues. The most common is the cough, but not everyone has a really strong cough. So I would say more than likely you do have a cold, which is another type of coronavirus more than likely. But is it harmful to get tested? Now, the only time that I would say it might be harmful to get tested or not worth your while is if you're not actually having a lot of nasal secretions. If you don't have that runny nose or a juicy cough or something, you might do the PCR nasal swab and get an insufficient sample. And so you might get a false negative in that case, in which case, it's not as helpful. You think you don't have it when you might actually do have it. If you're going to get tested, I would say if you wanted to, Bianca, you might be a good candidate for it because you have those secretions. You can also, if people want to make absolutely sure, you can follow it up with a serum test to look for antibodies toward COVID. So if you were to do both those tests and they came back negative, there's a fairly high likelihood that you don't have it. Lab testing is not infallible, but that if you did want to get tested, you could do that. Some generic information though, and I'm sure we'll all go into it, just supporting your immune system and supporting your respiratory function. Basic things like vitamin C and zinc and vitamin D are really helpful for any viral infection, which it sounds like you have some form of viral infection. We just don't know if it's COVID or not.
Are you taking vitamin D currently?
I am not.
Okay. Do you have vitamin D around?
But I got it in my house, ready to go.
Nice. So you don't have to go anywhere to get it. That's
right.
Good. Yeah, I would add that taking a little bit of a bolus dose of vitamin D can be a good idea, really for any respiratory illness. And there is evidence out, and we've talked about it before on this show about vitamin D and its ability to both boost your immune system as well as reduce unnecessary inflammation, which particularly in COVID, but in other illnesses as well, the inflammation getting out of control can be quite a problem. And I agree, it's unlikely that you would be positive for COVID, but definitely possible. But in any case, if it were to be COVID and it was early, you might have these mild symptoms, but if you happen to be one of the rare people who were susceptible to the inflammatory problems that come later, then hitting it hard with vitamin D at the beginning is a good idea. I typically recommend 50,000, which is quite a high dose, international units per day for 3 days in a row. And no one's going to overdose on vitamin D by doing that 3 days in a row. If you did that 300 days in a row, that could be a problem. You definitely would want to get tested. But that can be a good start for you.
I'm in. I want to feel better. I guess my question is like, what's the benefit of knowing it's COVID versus just a different, a regular cold? Is it just either way? I feel like you could spread it to your friends and to your neighbors. So either way, you should just stay inside until you feel better.
Yeah, the difference is that regular colds generally don't kill normal healthy people, and COVID can produce such a violent inflammatory cytokine storm that it does kill. So it is a deadlier cold virus. Regardless, yes, if you're sick, stay home, wash your hands a lot. Don't hang out with people. Yeah, that same advice holds true.
We're
Yeah,
also
and-
getting, closer to treatments if it is COVID. So it might be important to know if it is COVID so you can get appropriate treatment. At least from a Chinese perspective, there's many different approaches on how to work with or help somebody if they have COVID or if they don't. So it'd be important from a Chinese perspective to know the pattern of symptoms is what we call it. So somebody may have a cough, they may have respiratory issues, they may have a fever, they may have fatigue, they may have body aches and chills and stuff like this. And all these different symptoms are actually important. And based on your symptomology, we would then put together what we call a pattern differentiation, and then give an herbal formula and or acupuncture to help treat that person's pattern of imbalance. So 5 people with COVID may have different symptoms. So we may be actually giving them 5 different formulas, a different formula to each person based on their pattern of symptoms and the severity. So that would be important to, have some type of relationship with some type of a holistic provider that, is familiar with herbalism that could help you with that.
Yeah, absolutely. And I think I would just jump in on a few of those points. Also, if you have zinc as a lozenge, because as you're actually taking zinc as a lozenge, it can work at breaking up viral replication. So, you're trying to reduce the intensity or severity. And that,
those give me a tummy ache.
well, I would maybe just suck it up.
Yeah.
But you don't have to, of course. But it really helps. And I think from there's always that question like, the point is that whatever virus it is, I think that we're now entering into cold and flu season for the first time with COVID. And I think that we all have to kind of manage our panic buttons to understand that, cold and flu season happens every time this year. And so, not to, and to do what we've always done, hopefully, which is, self-isolate and take care of your body until you're fully recovered. So you don't pass it around. And then in terms of the question of like, do you starve or feed a cold or a flu or a fever or not? Generally speaking, there's so much energy involved when the immune system is fighting off an infection, and all of those symptoms that you described, that's your immune system fighting off the infection. It's not the virus itself. So as you're doing that, when most people have that tendency not to have much of an appetite, there's a reason for that, because you really are conserving and harnessing a lot of energy towards your immune system to manage going after the infection and managing inflammation. So it really is about lots of liquids, lots of warm liquids, like your cup of hot honey water. Could add a little ginger to that maybe. So just kind of going with that question, do you feed or starve an infection? You don't want to starve, but you definitely want to go with that natural inclination of not eating much, and
So
instead
craving
really,
for a piece of chocolate cake last night, I did not go get because again, I did not want to go outside and infect people, even though I had a real hankering. It was probably a good thing that I didn't
The
over.
sugar might make it a little worse.
Sugar
Sugar
can depress the
might
immune system.
aggravate your symptoms. I
Okay.
also would say, can I also just jump in with a comment that if you said that the zinc makes your tummy a little funny, sometimes I find with certain herbs or supplements, um, some are better on an empty stomach, some are better with food, some maybe are better on an empty stomach, but if it makes your tummy feel a little funny, then you take it with a little food so it doesn't give you as much of trouble. I know with herbalism, that's important is to know, the dosage, how frequently somebody's going to be, taking the herbs. Are they taking with food, or away from food? So if something is a little off for you as the individual, there might be a remedy to that. There might be a different way of administering that might work better for you.
and even honey is often a way that we administer, and different herbs.
Or even loquat syrup. I mean, we have in Chinese medicine, like these, or even in Ayurvedic medicine, there's a product called Cough Soothe, which a lot of my patients like, which is just wonderful. It's sweet, which you might like. It's got, because that's that loquat syrup, but there's also different medicinals that help to coat the throat, the larynx, stuff like that, and seems to help with that viral shedding that can turn into sore throat, acute pharyngitis, stuff like that, or even into the sinuses. Sometimes aromatic herbs can be very helpful for opening up the sinuses. In Chinese medicine, we say that's releasing the exterior. It tends to do with aromatic or herbs. Can help with the herbal formulas that can help eliminate what we call wind cold or wind heat. So it's good to work with somebody who can help you based on the different symptoms you have. Otherwise, there's a formula called Gamma Ling, which I like a lot, which is called common cold decoction, which works for all kinds of common colds. And you can find that at likely even Whole Foods. But that's a good start.
Okay. And with the vitamin D, Dr. Rob, should I take that on an empty stomach or a full stomach? My instinct is like take it with some food, but I don't know.
Either way can work, but vitamin D is generally better with food. It is a fat-soluble vitamin, so if you have some oil or fat in the meal that you're eating, it's going to absorb better as well. But generally, that's very well tolerated. There's very few patients who have side effects, although maybe one out of every less than 1% of people will have some tummy effects from that. But again, generally better with food. And along those lines, one other thing about zinc is that there are different forms of zinc as well. There is a form called zinc carnosine, which generally comes with a lower dose of zinc, which may not be a bad thing, but also the way that it's combined with the carnosine molecule not only seems to reduce the nausea side effects that a lot of people have, but actually is a gut healer. So people with leaky gut actually can take that to heal their gut. So you may want to look for zinc carnosine at some point and try that, and then you can have that in your toolbox in the future and not have to worry about the nausea.
And I know I know Heath or Dr. McAllister also has some thoughts on IV injection because I have a number of my patients sees him when they have respiratory or common cold issues. What's the
Yeah, absolutely.
way?
So I mean, with any respiratory issue, well, especially let's take viral infections in general. If in our clinic we do IV nutrients, so you can do a high dose of vitamin C, let's say. Vitamin C in lower doses is antioxidant, in higher doses is pro-oxidant, which means it's going to affect susceptible organisms, which a virus basically isn't technically alive, and it doesn't have its own defenses. So if you hit it with any kind of oxidative stress, which could be heat, could be sunlight, could be high dose vitamin C, it really helps destroy it. So you can do that. We do all sorts of other IV nutrients. We do IV zinc, we do the B vitamins, we do all kinds of things. Another thing I would say in terms of general lung support is glutathione. Glutathione is a tripeptide, 3 amino acids stuck together, and it's the primary antioxidant that our body produces. And in times of inflammation or tissue damage, your requirement for glutathione goes really up. And so the problem with taking oral glutathione is that our bodies are designed to break things back down, and then the likelihood of that reassembling on the other side in your bloodstream is low with glutathione unless you're using specific forms like liposomal forms. Whereas if you do the IV glutathione, it gets in whole, intact, and it has that effect. It's really important for breaking up congestion in the lungs and supporting inflammation of the lungs. So the whole cytokine storm issue, I think, could be greatly helped by glutathione IV.
Well,
And
go for it.
and then maybe with that, just a quick, if you're taking something at home, if you can't get a glutathione IV push, and then you could do NAC, which is a precursor to glutathione and will also help to break up the kind of all the mucus that you're experiencing. So that's something you could get at Whole Foods or any kind of health food store.
NAC being N-acetylcysteine.
You guys are getting fancy on me today, but I already feel better knowing that I have some solutions in my back pocket.
Well, we just adore you so much, Bianca, and everyone else who's suffering from type of respiratory issues. Hope this was helpful. Well, that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also, don't forget to subscribe to our The Well YouTube channel. Thank you for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in The Well are limitless.